If you've got neuropathy, then you're probably going through this progression of symptoms. First, you have pain, right? Pain in your hands, mostly in your hands and feet. It can occur anywhere, but most of the time, at least in our clinic, when we treat neuropathy patients, they start with pain in their hands and feet. Then they progress to pins and needles. You feel like you have pins and needles, or maybe like you're standing on fire, burning, right? Burning pins and needles, and then tingling, and something called allodynia is like super hypersensitive, like even your feet touching your covers of your bed sheets, it just like it lights it up, right? Or maybe even clothes rubbing, just gently brushing on your fingertips, and they're on fire. And then lastly, after the tingling, then you have numbness. And then it stops there. Once you get to numbness, it just stays numb, right? In the beginning stages of numbness, you might still feel some hypersensitivity, some allodynia, but then eventually it's just numb. You don't feel anything. So if you're going through that, all right, this video is for you. I'm going to do a series of videos of how we treat patients with neuropathy and how we've helped some patients reverse their neuropathy. Now, not all neuropathy is reversible for many different reasons that I'm not going to get into today. But according to Western medicine, the only neuropathy that can be reversed are the ones that are caused by type 2 diabetes. Because if you control your blood sugar, then the nerve problems go away, right? So that is the only one, according to Western medicine. But according to our clinic, we've treated thousands of patients and we are known for neuropathy. There's other cases, many other cases where neuropathy can be reversed, right? But you have to get into our clinic or some type of acupuncture clinic. You got to get in sooner than later. The later you wait, the chances of it being reversible goes to almost zero. Okay. But that's for another topic. Let's get into pain. You just got diagnosed where you started noticing really, man, pain in your hands and feet. And you've gone to your neurologist, you've gone to your family doctor, they've given you anti-seizure medications, they give you antidepressants, they give you gabapentin, which is a seizure medication. You've tried it, maybe it worked, or maybe you tried all of them and it didn't work. And those have many side effects, right? So whether you've tried those medications before and they worked and now they don't work, or you try those medications and they don't work, what are your options, right? Many neurologists will not refer you to an acupuncturist. Our clinic is in the Austin, Texas metro area. I work with the top neurologist. My team works with the top neurologist in Austin, Texas, and they refer their patients to us because they've seen the results. Okay, so let's go to pain. What can you do? You've tried the medications, you've tried the creams, they don't work, or they're very temporary. What can you do next, right? Obviously, acupuncture is one of the best tools, but in addition to acupuncture, what we do in our clinic is we prescribe traditional TCM herbs because the TCM herbs help the acupuncture extend the relief, first of all, and for some cases, it can actually help fix the problem. It can actually help you eliminate the pain, right? How cool is that? Let's dive into my nifty little dashboard. So I created this dashboard, neuropathy pain and TCM herbs, specifically TCM herbs for pain. I'm going to go over, I have other dashboards that are going to be TCM herbs for the tingling, right? The allodynia, and most importantly, the numbness. Because when you start having numbness in your hands and feet and your nerves, those nerves are dead. That's the reason why you don't feel anything. So there are herbs that can actually help you regenerate those nerves, right? So, but that's another topic. Let's come to pain, the beginning stages in neuropathy, right? And so, neuropathy, pain, conventional medicine, Western medicine, besides diabetic induced neuropathy, all other neuropathies, according to Western medicine, there is no cure, there is no fix. You have to take some type of medication for the rest of your life. Okay. That is from Western medicine. Now, where Chinese medicine fits in, the research There is not going to be any research that shows that Chinese herbs can reverse nerve damage, that Chinese medicine can help the nerves regrow. There's not going to be any research on that. Why? Because who's going to pay for it? Who benefits from that, right? So if it's nature, it's not patentable. Pharmaceutical companies, they can't patent it. So of course they're not going to pay money to do research. So the only thing is to rely upon clinics like my clinic and my team, where we actually have live cases, real patients. You can check out our testimonials, real people who've had their neuropathy reversed after coming to our clinic. Okay. So my point is Chinese medicine has the potential. Can it do it for everybody? No, it can't. I'm not going to say, oh, it's a cure-all. No, it's not. It's specific cases at specific times. You got to get in as soon as possible. Do not wait 5 years, because your chances of it being 100% reversible or even 90% goes down to 20, 30%. Okay. But it's still worth it. So Chinese medicine, it lowers the pain signaling, it calming microglia cells, changing ion channel activity, improving microcirculation, which is crucial. Microcirculation is crucial. None of the medications increase microcirculation. This is why traditional Chinese medicine is so effective, because these herbs that I'm about to share with you that we use in our clinic can increase the circulation specific to your capillaries, which are the micro vessels, right? That is the key, because those nerves that regenerate, the nerves that are in your fingers and your toes, those require microcirculation. And if you don't get microcirculation, they will never regrow. Okay. Current evidence supports pain reduction, not guaranteed nerve regeneration. Again, no one's going to do the research. Okay. No one's going to pay for the research for this. So how these herbs lower neuropathic pain. So this is research that has already been done for these herbs to prove that they can help you with the pain, right? And so I've got all the links here. Okay. This information that I'm going over is not my opinion. It has been clinically studied. It has been researched, double-blinded, random clinical trials, all the wazoo. I got the links below. If it is my opinion, I will let you know. This is my opinion, right? Okay, so neuroinflammation. So basically, it decreases inflammation in your nerves. Curcumin, Coridalis, salvia, these are the herbs that I'm going to go over, okay? Channel and synaptic modulation. This is a conatum and a chorus, these two herbs. Microcirculation and nerve perfusion. Nerve perfusion is getting that blood circulation to your small fiber nerves, right? There's a small fiber neuropathy. Well, the reason why Western medicine can't do anything about it, because there's no medication that increases microcirculation and nerve perfusion to allow the little tiny nerve fibers to grow. We have in Chinese medicine salvia and ligustrazine combination. Central analgesic without classic opioids. Coridalis is the #1 pain herb. If someone comes in for any type of pain to our team, then our team will always put this Coridalis in their herb formula. Not a single herb, but in their herb formula. And this is a good segue to remind, if this is the first time watching my videos, in my clinic, my team never prescribes just one herb by itself. Never. We always customize a formula which contains 30 to 40 herbs. And if you have pain, we will put Coridalis in there. Okay. So the reason why we do 30, 40 herbs, and this is my secret recipe, is I found a way to neutralize the side effects of herbs so that you only get the benefit of TCM herbs, right? So do herbs have side effects? Absolutely, they have side effects. Very minimal compared to medications, okay? But they still have side effects. But we can combine one herb to neutralize the side effects of this other herb, and so that you only get the benefit of this one herb. How cool is that, right? All right, so let's dive into the main herbs. And before I do that, got to give you my disclaimer. Otherwise, Google or YouTube will shut my channel down. I am not a physician. I was not trained in acute medicine, emergency medicine. I was not trained in that. I was not trained to prescribe medications. I was not trained to do surgery. Right? What I was trained in was restorative longevity care. Actually, that's what I created. I was trained in traditional Chinese medicine, acupuncture, herbs, nutrition, longevity. That's what I was trained in. The difference what I do is in my team, what my team does, we help people restore their body's God-given ability to heal itself so that they can heal by themselves, even without us. That's what I call restorative longevity care or restorative care. Okay. It's different from restorative medicine. So that's what I was trained in. And let's get back to the dashboard. So Coridalis in Chinese, Yan Hu Suo, #1 herb for pain. It doesn't matter what type of pain you have. You should have this in your herb formula combination. Okay. Do not take this by itself. There are some side effects, which I'm not going to get into. So there's some GI side effects, but if you combine it with other herbs, you can just get the full benefit of this herb without the side effect. That's my secret recipe that my team executes in our clinic. It's a strong, non-opioid analgesic for both inflammatory and neuropathic pain in animal studies. It can help with nerve injury pain, modulate spinal pain pathways without opioid tolerance. So here in the US, there's a huge opioid crisis where I think about 5 years ago, physicians were just handing out opioids like candy. And people got addicted, and now they had a drug addiction problem. And so how did it start? It started with physicians just handing them out like candy. So now the government said, no, you can't do that. You got to do other medications before you do these opioid because they're highly addictive. They make you a crack addict. Best use case, severe neuropathic pain, right? Very good. So Coridalis, and here's all the sources. If you want this dashboard, just comment dashboard in the comments below, and my team will give you access to this. Okay. Next herb is Shi Chang Pu, which is Acu calamus. Acu calamus. This reduced pain behaviors in chronic constriction injury, sciatic nerve ligation models. So the sciatic nerve was cut, right? So super also effective for pain, and I'm going to tell you another use for it later. It decreases mechanical allodynia. So remember, allodynia is like you're super sensitive to everybody, like maybe even the wind, the air conditioning blowing on your toes and your fingers will make your pain just fire off, right? This herb can help with that. Okay, thermal hyperalgesia, oxidative stress, antioxidant activity, histologic nerve damage. You'll see, why are these herbs used for nerve damage? Could it be that they can help restore the nerves, help the nerves regrow? Yes, that happens in our clinic. I can't say for every acupuncture clinic, but in our clinic, we have tons of cases. And so nerve regeneration, your nerves do regrow. Not all of them. When you get to numbness for 10 years, they ain't regrowing. Once you first get that neuropathy symptom, your nerves are still regrowing. That is the time you need to get into an acupuncture clinic ASAP. Yes, you need to go to your neurologist, do all the tests, and you can do all their medications. But if you want your nerves to regrow and that pain to go away permanently, you need to get into an acupuncture clinic ASAP. Actually, I would say a TCM clinic, it's not just acupuncture. Someone who also does Chinese herbs, TCM herbs, okay? So, Shi Chang Pu, peripheral neuropathy, strong burning or shooting pain, or oxidative stress, inflammation, or major concerns. Broader protocol targeting nerve protection and symptom control. Shi Chang Pu is also another herb that is super good for your brain. Your brain is your CPU of your body. It sends messages. It tells the rest of your body what to do. It's like your commander in chief. It tells you, hey, body, move blood to my peripheral nerves and move more nutrition there. This herb, Acu, can directly help the brain tell the rest of the body to increase the blood circulation specifically to your little capillaries, your little small fiber nerves. It can clear up your mind, brain fog. It can help your brain function even better, okay? Next herb is curcumin. Probably heard of that, right? In Chinese, it's actually called jianghuang. Curcumin, you got to be careful. Again, all of these herbs, do not take them by themselves. If you want herbs to be safe, you got to take them in combination with other herbs. Never take TCM herbs as a single herb. So curcumin is good for the cold allodynia, spinal nerve ligation. It's good for diabetic neuropathy, downregulation, inflammation, suppresses myoglial activation, improves nerve conduction velocity. Nerves, if you go to your neurologist, they'll do something called a nerve conduction test. right? And it ain't comfortable. I've never had it done because I've never had any nerve damage, thank God. But all of our patients who come to us, they go to neurologists and they do the nerve conduction test, and it is pretty painful. But that's a good thing. You should feel pain. If you do a nerve conduction test and you feel no pain, that's a big problem. Okay. But curcumin can help your nerve conduction. Your nerves communicate through electricity. That's what nerve conduction is. Okay. Next herb, salvia, danshen. Salvia, diabetic peripheral neuropathy, nerve conduction. This herb actually, not only can it help increase the microcirculation, it can actually help move nutrients. And it has nutrients in this herb that can help your nerve regrow. Okay. But nerve regrowth is super slow. One little nerve fiber is 1 millimeter per day. Now you may think, oh, 1 millimeter is, oh, that's pretty big. You gotta think, how many nerves are in here? Just in your fingertip? Trillions of nerve. You need all of them to be growing at 1 millimeter per day. We can't speed up the 1 millimeter per day, but what Chinese herbs can do is to help, instead of just one single fiber nerve to regrow 1 millimeter per day, Chinese medicine can help 1,000 nerves regrow at 1 millimeter per day. Again, this is not scientifically proven. It's just been proven in our clinic by my team. Last herb, fuzi, aconitum. Okay, you gotta be careful. This herb is toxic. Do not buy this over the counter and use it yourself. It's very powerful, but it has lots of side effects. You can't just go to an acupuncturist and get this herb. You need to go to a clinic that practices Chinese herbal medicine. Not all acupuncturists in the US are required to train in herbs. Many of the East Coast states, they're not required to train herbs. They're not required to get herb education to get their license. In the state of Texas, we are required. State of Texas is one of the few states that requires you to be trained in Chinese herbology. Okay. Not all states are. I know California is, and I believe New Mexico is as well. I believe so, but don't quote me on that. I just know for Texas because we're in Texas. Okay. So it can help with your EMG improvement. So again, nerve conduction. It can help with your EMG improvement. Extreme neuropathic pain with low risk options have failed. It says right here, the way this herb is prepared, you can't buy it from any herb manufacturer. It has to be prepared in a certain way. It has to be prepared with another herb in order to neutralize this toxicity. Okay. And you can't dose this too high. We don't use this herb on everybody. It depends on the case. It depends on our diagnosis. My team uses, I created, called functional pulse diagnosis. So I would say from all of our neuropathy patients, this is one of the herbs we use the least amount because it's toxic and not everybody fits the diagnosis. It helps with the sodium channels, disrupts synaptic transmission. It suggests major reductions in burning and electric pain. So safety warning, overdose can cause fatal arrhythmias and neurotoxicities. So again, let me just repeat that if I haven't said enough. Do not take this herb by itself. Do not take this herb from anybody who has not been trained in Chinese herbology. Okay. And when I mean trained, at least they have a license. Their license requires them to pass a board exam for Chinese herbology. Again, not all 50 states require the board exam for Chinese herbology. Most states only require acupuncture board exams. So many acupuncturists in the US are not trained in herbs. You got to be careful. But the training doesn't mean that they also will know what they're doing. You got to ask testimonials, Google reviews, read those. So these are the top 5 herbs that we use that are very good. Is the only herbs we use for neuropathy? Pain? No. We use tons of herbs, right? But it's not based on, oh, pain, then we give everybody this. No, no, no. We may have 100 neuropathy patients who have pain with the neuropathy. And those 100 patients, we may give 100 different formulations, herb combinations. No single person has the same herbal combination. That's our secret sauce. That's the reason why we get phenomenal results with neuropathy. And that is the reason why one of the neuropathy nonprofit associations, they had a medical advisory committee. And on that committee, they invited all of the top neurologists in Austin, Texas to join that committee. I was the only acupuncturist and Chinese medicine practitioner to be on that advisory committee. Okay. Just because of the results that we get. So this was just an example of what we do. You need to find someone who has treated neuropathy and they know what they're doing with these herbs. They've done it before, not just know, they've done it before. Okay. Knowing is different from doing. Okay. So look, if you can't come to our clinic, then find a clinic who has done it, been there, done that. Not know how to do it, been there, done that. Okay. Look out for the video that I'm going to do for TCM herbs for neuropathy when it goes to numbness. What are the herbs that can actually help regenerate your nerves?